Hello and welcome to Askimo TV. We're talking today to Dr. Robert Greenbaum. Dr. Greenbaum is a senior cardiologist working in London at the Royal Free, Barnet and Wellington hospitals. He is a past president of the cardiology section of the Royal Society of Medicine. He treats the full range of adult cardiology and has a particular interest in coronary angioplasty and implantation of pacemakers. Hi, Dr. Greenbaum. How are you?
Good morning. I'm fine, thank you.
Dr. Greenbaum, let's talk today about heart failure. What is heart failure and what other names does it have?
Heart failure simply means that the heart is unable to efficiently pump enough blood around the body. The heart basically is simply a pump, and its job is to supply all the other organs, the brain, the kidneys, the limbs, with an adequate supply of blood, and in the blood is the oxygen and food requirements to allow these other parts to function. The common reason these days patients develop heart failure is because they've had problems with their heart arteries, and that has led to a heart attack and damage and death of heart muscle. Just as you are born with two kidneys and can function with one, you don't have two hearts, but you do have a lot of spare heart muscle. But over time, with damage, the heart muscle will weaken and not work as well as it should. There are two main groups of symptoms that patients get with heart failure. The first is that they notice they become progressively more short of breath, and they may notice that first when they go upstairs or walk up a hill. And then later on, they may notice it when they're walking around the house or even doing quite minor things. And the other thing that patients notice is that they just lack energy. They feel just tired and just don't feel good at all. So those are the main symptom areas for heart failure.
How is heart failure diagnosed and what treatment options are available?
Well, heart failure, usually it's first based on the suspicion of the physician when he speaks to the patient. The sort of tests we do, there are a variety, but the main thing we do to assess the function of the heart is what we call an echocardiogram. This is an ultrasound technique where a little probe is put on the chest. There's no anesthetic, there's no x-rays. And using ultrasound, we build up, you can think of it as a radar type picture of the heart and the muscles, and we can show if the heart is stretched, is dilated, or if the heart muscle isn't pumping strongly. Can also look at the heart valves, because for some patients it's a problem with the heart valves that's actually led to the heart failure.
So if you diagnose somebody with heart failure, what treatment options are available for them?
Well, these days, usually we look in more detail, and we tend to look at the coronary arteries, the heart arteries, to see whether it's a problem with the blood supply to the heart. And for some patients, but not all, they may be suitable for treatment such as angioplasty or bypass surgery to improve the blood supply and therefore improve the function of the heart. For other patients, we have a variety of medications which we know can both improve symptoms, particularly breathlessness, and also to improve the outlook for these patients, keep them out of hospital, and make them feel better.
Is there anything that patients can do or people can do to try and prevent heart failure?
Well, really it's around, because it's in many patients it's at a later stage of heart disease, so we'll have looked to them to keep their blood pressure, cholesterol down in order to prevent the progression of heart failure. Unfortunately, heart failure is the one area of cardiology where we're seeing more and more patients. And the reason is that many patients now are getting to old age who've survived heart attacks and bad heart disease for many years because of treatment with bypass surgery and angioplasty and also medication. And unfortunately, they're now getting to a stage where their heart disease is catching up on them.
Just to end off, what should patients know about life after heart failure?
Well, they should know there's a lot to do, that we can do, both to make them feel better and also to get them to lead a long and productive life. But it does require close working with their physicians and the support team to do that. There's a lot that can be done.
Thank you, Dr. Greenbaum. Thank you so much for talking to me today.
Pleasure.